My name is Ryan Dumas. I'm an assistant professor at UT Southwestern in Dallas, Texas, and at Parkland Memorial Hospital. I'm the principal investigator in a 2021 EAST multi-center trial entitled Intravascular Access in Hypotensive Trauma Patients, an Eastern Association for the Surgery of Trauma multi-center prospective observational trial using trauma video review. My co-PI is Dr. Michael A. Vella from the University of Rochester, and this study is sponsored by Daniel and Helena from the University of Pennsylvania. This will be the first multi-center study to utilize trauma video review as a data collection tool. This prospective observational trial will evaluate and compare the procedural speed and success rates of vascular access in patients at risk for hemorrhage. We'll also evaluate the association between initiation of resuscitation and patient outcomes. The ultimate goal of this trial is to leverage the power of trauma video review for data collection. This tool really allows us to stop, pause, rewind, and even fast forward videos of trauma resuscitations. This granular level of detail has never before been utilized to examine acute trauma patient resuscitation. We know that approximately 30% of level 1 and level 2 centers across the United States utilize this technology. Using this technology will allow us to very accurately measure the time it takes to establish IV access in this patient population. Additionally, we'll be able to study team performance and team dynamics as they care for acutely injured patients. So what exactly do we want to measure? We're interested in studying vascular access in hypotensive trauma patients. In particular, we're interested in studying IO, or intraosseous access, the speed at which it takes to place a central line, or a CVC, and the speed at which it takes to place a peripheral IV. Not only the speed, but also the success rates of each of these procedures. Additionally, we're interested in studying the time it takes to initiate resuscitation, and also the time it takes to make a clinical decision to perform a procedure such as a chest tube or thoracotomy. Additionally, we will collect data on team communication and teamwork. The aims of this study are twofold. One, to determine the time to intravascular access using IO, PIV, and central venous catheter in trauma patients presenting with initial systolic blood pressure of less than 90 millimeters of mercury. The second aim is to determine the success rates of each of these types of intravascular access. For the purposes of this study, the inclusion criteria will be any patient above the age of 16 years old presenting to the hospital in shock that we have defined as initial systolic blood pressure of less than 90 millimeters of mercury. We will exclude patients less than 16 years of age and patients that arrive with pre-hospital IV access in place and do not undergo any additional IV access attempts. The primary outcome of interest will be the duration of each IV access attempt, measured by the start or visualization of insertion needle on the trauma video review, and the access attempt stop time, measured by visualized flushing of the IV access on trauma video review. Additionally, we will study several very important secondary outcomes. This includes the success of each IV access attempt, the median duration of failed attempts, the time it takes to initiate resuscitation in a patient, and the time of IV access placement. We'll additionally measure various administrations of medications, transfusions, and ultimately the time to the next phase of care. We will also measure certain patient-centered outcomes, such as return of spontaneous circulation and mortality. To collect this data, we will use an easy-to-use data collection form that will be shared with participating centers using the REDCap online data collection tool. If you are interested in participating in the study, please contact us. The only really requirement is that you have a TVR or a trauma video review program that is currently in place, and you have the infrastructure to view, record, and collect data from trauma video review recordings. Please contact myself, Dr. Michael Vella, or Dr. Daniel Helena to participate in this trial. We look forward to working together and to improving the ways in which we acutely resuscitate trauma patients when they present initially in hypotensive hemorrhagic shock.